Dr. Siddiqui, Waqar Siddiqui. He's a well-known, has been in our community for a long time and have been serving community. He's a practicing physician with the adolescent psychiatry and young psychiatry, young and adolescent, and inshallah he's going to give his presentation. There were a few questions were asked to me about that. While he's getting ready, I'll deal with those questions in a moment. Do you have a presentation? You have a PowerPoint? Maybe just okay. I gave you that vitamin thing I wrote down, the natural health food thing. Any of these things which are written here, there is no mention about halal or haram on it. So if you want to go and buy anything of the vitamin supplement, anything with the gelatin in America, if it is not written, it may involve pork products. So you need to look for halal vitamin and halal sources. Vitamin D is very deficient in America today because we live north of equator, heat and sunlight is not much exposed to our body. Naturally, you can develop your own vitamin D from your body by exposing your skin to sunlight for 15 minutes. That's the best way. It generates about 10,000 units. You expose your skin to the sunlight for 15 minutes. 15 minutes आप सूरज की रोशनी में बैठेंगे, आपके जिस्म से अल्लाह ताला कुदरती तौर पे vitamin D बनाता है. Because we live north of the equator, we do not get a whole lot of exposure to the sunlight, so vitamin D supplementation is taken. So make sure it's not gelatin type, it's the tablet form. So you can find the halal vitamin sources and they have all these products. Number two, I think there was some other question was asked by another brother. You can also buy flaxseed or fish oil. For those fish oil, they are gelatin one, but if you buy krill oil or liquid form, that does not have a pork product in it. So that's one that was the important point. Inshallah, I'll think of the other question. We'll talk about, inshallah, we'll start with Dr. Siddiqui. And thank you very much for coming. Yes.
Assalamu alaikum wa rahmatullahi wa barakatuh. Can you hear all this in the back?
Yes.
Okay. Bismillahir Rahmanir Rahim wassalatu wassalamu ala khatim nabiyyin sallallahu alayhi wa sallam wa alihi wa ashabihi azwaji zurriyati ala bayti ajma'in برحمتك يا أرحم الراحمين أما بعد. I just want to apologize first that I couldn't be here earlier. Actually, my daughter is getting married next week, and you can imagine it's very hectic and very busy. And since my brother Dr. Faruqi has asked me for this lecture, I of course could not refuse, and I haven't prepared anything, but I will talk briefly about behavior disorders in children, particularly focusing on much common like opposition defiant disorders, attention deficit disorders, autistic disorders, and also touching anxiety and depression a little bit because it plays a big part in the cause of these disorders as well as the consequence of these disorders. I would like to make it more like interactive. If you need to ask any questions as I'm going, I'll be more than happy to answer the questions. But before I go into these disorders, I would like to just give a brief kind of a preview, especially keeping in reference to the Muslim community in the United States, the challenges we are facing, and also giving some Islamic perspective. I will try to be brief, as I want to spend more time with the disorders I'm going to talk about. The Muslim community in the United States faces a great deal of social challenges. And as you know very well, these challenges are brought about so many forces, so many things which have been happening. Most importantly, the forces are from the mainstream society, which are influence of media. We know that media has a big influence on our life, and of course it plays a big part, and we talk about later how in the cause and this disorders. Secondly, very rapidly increasing incidence of substance and alcohol abuse in the community, and then you'll be surprised that it's also prevalent very much in the Muslim population. and also increasingly decline of the family values, and increased violence and gun in the society. And more importantly, of course, the rapidly increasing incidence of mental illness in adults, more particularly in children and adolescents. This which is my topic today, which I'm going to talk. And also, very importantly, is the atmosphere of our society, of Muslim society. Especially if we have this bigger problem of not able to be cohesive. We are not united, and we are divided across different ethnic, sectarian, mazahib, and other lines, which prevents from a cohesive and united way to discuss these disorders, to seek guidance from the professionals, and to be more aware, to increase awareness in the society. And I really appreciate Brother Farooqi, who has really made this thing possible, which is, I think, is a great example for others to follow. And how these forces really interfere, or I would say, make it difficult, the task of creating families, the marriages is a big problem in the society here, the marriages, and also to maintain the marriages. We have a big problem with the increased divorce rate and separation in the families, which is a big problem. And I have been seeing in my practice, I would say every day, I was seeing that. And also raising children in this society, keeping in view on one hand the challenges that I just discussed before in the society, and this increasing number of these disorders in the children. And more importantly, I would say how we support our families, our relatives, our friends and neighbors in order to get together and to be able to increase the awareness and education about these illnesses. Unfortunately, we don't have much task forces, or I would say much more organizations in Muslim society. We need to have these more forms in order to deal with this problem. I will just give a brief perspective about the Islamic perspective. God has given us this beautiful religion which really can use very much, especially the Quran and the Sunnah of Rasulullah sallallahu alaihi wasallam, to deal with these illnesses. And I will quote this beautiful words of Surah Al, which Allah subhanahu wa ta'ala says, "O Muhammad sallallahu alaihi wasallam, I have sent upon you the Quran, which explains everything, and it is a guidance and a blessing." So if you look into Quran, there have been so many ayahs and verses which have mentioned about the root causes of these problems, these disorders, especially spiritual problems. And we can see how many times the Quran discusses the nafsani or diseases and all that. I'm not going to go into doing that, but I just want to touch briefly about that. And also in the ahadith of Rasulullah sallallahu alaihi wasallam, there have been mentioned so many ahadiths in which he has emphasized on the treatment of mental disorders. I mean, it seems like in Muslim society, or is a cultural thing, or is a religious thing, it is considered a myth, or it's like a taboo not to talk about it. But Rasulullah sallallahu alaihi wasallam has openly talked about it. He used to make prayers and du'as to seek refuge from these mental illnesses, and for himself and for others. So this will I leave it there. But I want to say in Islam, the mental illness is a condition which results from an imbalance of so many things. Imbalanced lifestyle. And if you look around, we all have very imbalanced lifestyle, which, of course, I'm sure other doctors before me have discussed it in detail, which includes the diet, the exercise and physical activity, the sleeping habits, and also, I would say, spiritual activity and remembrance of God, and also healthy social interactions among the different circles, and learning and education. And there's a popular belief in our society and culture, which is basically because of lack of education. They believe that these illnesses are caused by some kind of supernatural causes, like jinns or spirits and all that. And most of the times, it delays the diagnosis of these disorders and delays the treatment. And sometimes I see these patients who come in a very advanced stage, because most of the time they're running around seeking treatment from some kind of people going for some pir, fakir, and getting some kind of all these different totkas and all that. And that sometimes so much time is consumed in that when the disease presents to us, it's really in an advanced stage. And sometimes it can have bad consequences. If we know the consequence of not treating the disorders, we'll discuss that, how it can lead to so many problems like violence and drug abuse and substance abuse and of course, separation and divorce and all the things in our society. We have to understand that in Islam, as a Muslim society, we have to first accept that mental illness is a legitimate medical illness. Just like anybody has headache or pneumonia or stroke, it is a very genuine medical illness, which is caused by very genuine, proven biochemical, neurochemical impairments and disturbances in the body. And just like it is caused by this disturbance, it can be treated also in the same way, biochemically, pharmacologically, psychosomatically, and other modalities which have been now coming forward with the advance in the psychiatry in this era. So with that background in our mind, I'm going to talk about these disorders one by one, and I would appreciate if any questions or Dr. Faruqi wants to make any comment or that we can, in reference to our medical situations, I will be more than happy to discuss that. The first disorder which I'm going to talk about, which is I think a lot of times is misdiagnosed and is not treated early, and also sometimes mistaken as a normal behavior in children. And that is the oppositional defiant disorder. In other lay terms, I can say disruptive behavior. I'm sure you have heard this in children. They're very disruptive, and you heard that they're oppositional and defiant. They won't listen. But if you see a child who is persistently not listening, like you call his name like 10 times, 11 times, not listening, and the child is constantly refusing to comply with some very reasonable, adults, instructions, that's the first sign there's something wrong going on. And the child is constantly, persistently irritable, all the time, and all the time annoying other children, and also disrespecting the adults. And also, sometimes when you ask them or confront them, why you're doing all this, the child says, blame this on other people. Either blame on the other brother or the friend or parents. These are the common way they present. And they're spiteful, they're resentful. And this kind of behavior I see a lot of these patients which present. Unfortunately, a lot of these parents, what they think that the child is going to grow out of it. Like, they think, oh, this is okay, he'll grow out of it. Well, I understand that you see a children who is 3 years old or 2 years old, they're terrible 2s and terrible 3s, we know that. But if you see a child who's beyond the terrible 2s and 3s and in 4 and 5 years of age, and the child is getting complaints from the school, from the primary school, from the nursery, then you have to really raise red signal, what's going on here. And you also, because they are behaviorally not functioning, they're also not doing academically, it's affecting their academics. And if you go into these disorders, it's very interesting to know that the cause of this disorder is biochemical as well as genetic. There is a very genetic link which shows in the studies that is more commonly seen in on those children whose parents, one or both, suffer from a mood disorder, depression, anxiety, or sometimes these parents are never diagnosed, never treated, and sometimes this interferes with their upbringing or parenting of the child. That's the main problem. I see in mothers who have been depressed, never treated because it's a myth, they're fine, and that sometimes when they raise a child like a mother who is depressed, most likely to raise a child who will really become opposition and defiant and irritable and aggressive. This is a very common, and studies have proven that. And unfortunately, we have this in a lot of our society. And then these children, if they are not treated, if they go on like this, sometimes this can lead to a very serious disturbance, which is called a conduct disturbance or conduct disorder, in which the child's behavior from school and home spills over into society. When the child starts, refusing to comply with the social norms and the society norms, like the child starting violating the rules, like the child, not start stealing. You see a lot of this going on. And sometimes they become aggressive and hurting people. Sometimes they get involved in substance abuse and drug abuse. These kind of things, and again, they start running away from the home, they stay out of the home, late, because this disorder can go from age 4 or 5 up to the adolescent age. Opposition defiant disorder. But if it persists after the adolescence, the adolescent, say, if is driving, then they will be violating the rules in the driving, constantly getting tickets, suspended licenses, and also again other things like stealing and breaking property, destruction, all those things, and really get into much trouble. And this disturbance can lead to in future a very significant problem which is called antisocial personality. So you can see how this takes you, just a very moderate or mild symptoms of opposition defiant disorder, if they're not treated in the right way, can lead to a longing personality disorder. And then it becomes a part of their personality. So just to give you an idea, and as far as the treatment is concerned, if you address this disorder very early in life, especially involving the families, and see what is the root cause of the problem. If the root cause is a bad parenting, we have to get the family involved. A lot of times, if you address them early in the parenting by using different ways, like we can use behavior modification techniques, which we use. I can't go into details now, but basically you need to, first of all, you have to set up some limits, boundaries with children, and use positive and negative reinforcement in which if the child's behavior is improving, you give them positive enforcement, give them rewards, not excessive rewards, but reasonable rewards. And again, if the child is not listening and not performing as supposed to be, then negative reinforcement by taking away things, especially taking away things which the child enjoys a lot. And of course, it's going to hurt him the most if you take away his iPod or his, or his other things which he has, the TV, watching the TV programs and the cartoons and all those things. If you can take away those things, sometimes that helps. But a lot of times, we see, society, I see in that the families are so busy either in their own problems, the parents, or in the personal problems, the family problems, or they have their own lifestyle that they never pay attention, and then this cases gets worse. So most of the time it can be treated by individual therapy and also by family therapy, and most of the time these children respond very well to early interventions. But as I mentioned, if they becomes more, going to the severe problems, then it would need some medications. And that would be symptomatic. If the child is aggressive, you have to use some medications to address their psychotropic medication to address their aggressive behaviors. If they have trouble in focusing, you address them with, I'm going to jump to the next topic, which is attention deficit disorder. You want to make a comment?
Just one thing, I want to announce those brothers who came in for the Zohar Salah should know that Salat al-Zohar will be a little delayed. It will be at 1:45 today. They will be here to pick up the children. So we have made an announcement, and they should be here to either pick their children up or they can wait to finish the program.
So if you have any questions, you can always ask me about. You have questions?
You talked about early intervention. What is the age that a person should try to intervene?
I would say at the age as early as 3 years old. Yeah, because if you let it go, you have to get the child evaluated. There's early intervention programs available. You can always get the numbers of those programs in your county or in your city, and you can get the child evaluated. Initially, what you should do, I would first of all, as the rule of the thumb, you have to rule out the medical stuff. So you have to have them seen by a developmental pediatrician, one who knows about the life stages of the children, and that he or she can rule out if the child is suffering from a delay in the development. If this is for any medical reason this is going on. So first you have to rule out any developmental delays, which can also present in similar fashion. A lot of kids who develop autism or mental retardation develop these things in the early phases. So first you have to have a child be seen in an early intervention program and seen by a developmental pediatrician. And once the pediatrician rules out other things by doing all different kinds of testing, they can order, I'm sure they can order all kinds of neurochemical tests, like ruling out all kinds of genetic disorders, which can present like, fetal X syndrome, which is very commonly seen in all of these children who are very aggressive, and other conditions, Leigh-Hand syndrome, when the child is very aggressive in the early stages. So they can do all those tests, ammonia levels and the metal levels, the lead levels, all those things can be done to rule out the medical causes which could possibly present the same way. But after they rule everything out, that child should be seen by a child psychiatrist. It should be evaluated and we should not be really kind of hesitating to do that. It's not something bad if the child is going to see a child psychiatrist. There's nothing wrong with that. That's what I'm emphasizing on that. So with that, yeah.
I would like to request those who are out there making noise, those children either sit down and please do not make noise. I do not want to hear any noise. All the children should sit down. If your parents are here, they want to take you, please very quietly take your child out. Do not disrupt the program.
Okay, thanks. So that's a good question. I think we can definitely, make this habit for the parents to have these checkups, especially these evaluations done if they really suspect something going on.
A lot of times the parents said if we take the kid to the doctor, they're just giving them a sleeping pill, what they're going to just slow them down and nothing else.
Well, I think this is really a myth more than, I don't think, I myself a child psychiatrist, and believe me that we never prescribe medications unless we have addressed all different modalities, which includes family intervention, family therapy, individual psychotherapy of the child, and also looking into other factors. And we never prescribe medication in the first place. In which we get them evaluated and by a psychologist to do a psych testing. It is a testing which is done to rule out, in which they use some computerized test which can rule out if there's anything else going on psychologically with the child, or if there's any family problem going on which is affecting the child, or is there any developmental problem going on. And those should be done first to rule out those, and then of course if there is a need, if the child's behavior is really making a risk to himself or others, and especially also to his family members, and also to the school, if his behavior is interfering with his functioning, then at that level, he will prescribe medication. So I don't think if this is really the correct. I'm sure there are some doctors, of course I'm not speaking for everybody, but then after, of course there are some doctors which may be doing that. I'm not saying that they are not, but I think the proper approach will be to address the other psychological modalities first before going to medications.
Can I inject something regarding your comment that parents are often scared to bring their child to psychiatrists? Our community is the worst in that manner, should know. As a physician, I know we don't want to label our child have a psychiatric disorder. We don't think that psychological disorder are a real biological problem. I tell all of my patients, like a person who have a blood pressure, the one who's having a heart attack, the one who have a diabetes, who have ineffective working thyroid gland, you cannot talk that person out of illness. Psychiatric disorder is a real chemical problem. They are not demon possession. There are no jinnat on them. There is no emotional, psychological deficiency. They are very intelligent people. Their certain part of the brain are not working right. If you bring them to the psychiatrist, that will help your child. If you find your child is not doing good in school, is not sleeping in time, as you mentioned, defiant child, you tell them to do something and they don't do it, that child has a psychological problem with the medical disorder. There are chemical brain neurotransmitter which is known as GABA and histamine and what you call the serotonin and dopamine. These are the chemical involved in our brain. As we speak, these chemicals are working. If those chemicals are deficient or disbalanced, many of the disorders are due to that. And those need to be treated, and they need to be treated after a professional evaluation. As he said, very first thing, we go to Maulana Sahab, uske dam kar do, bachche pe dua kar do, aur kisi ko taweez bando. Those are your treatment, not the child treatment. You should understand medical disorder. You don't take a heart attack patient. One psychiatrist said to me a very beautiful thing. Give me a moment to explain to you. If a cardiologist tells you you need to get a bypass surgery, you never go home. You always go to that surgeon and get yourself bypass surgery done. But when the psychiatrist tells you you have an emotional disorder, your child have a learning disability, you think the psychiatrist is trying to make money. They didn't sell their wealth. But the most efficient, the most fastest working medication in the medical science are the psychiatric medication. When you have anxiety, panic disorder, depression, you take blood pressure medicine for a lifetime. Nobody ever takes back. Anxiety medicine, they give you, it works in 15 minutes. Alprazolam or Xanax, 15 minutes just calms your anxiety down. When you take depression medicine, they work within a month. Nobody with a cholesterol or hypertension or diabetes and another disorder can ever be treated within a month. These medicines take effect and they work. That's why doctor was just mentioning. He cannot speak for everybody, but they don't dispense pills like that. And most of us, ask in our Asian community how many people are on antidepressant. But most of us don't sleep at night. Most of us have family disorder. We have a marital disorder. We have a lot of personal problems, but we like to be a very close community. We never go out. So listen to the advice, and if you have a problem, you see a child having a problem, bring it to the doctor. Thank you. Sorry.
Thank you so much, Dr. Farooqi, for really elaborating that, which was very good. Now, with that, I'm going to go into a very important disorder, which is, I think, is so common, and the school is the one which presents to you. Yeah.
I have a question. If a child is most behaved in school, but not listening at home, do you think it's a psychiatric issue, or it's just a childhood habit that will go off?
Okay, that's a very good question. That's a very good question. Usually in these disorders, you have to have this problem present in more than two or more than two settings. Just if it is present in one setting, like if they, as you said, that child is only has problem in the home, the child is fine in the school, which means the problem may be in the house. Because otherwise, if this is a biochemical problem, it will be present in all settings, like either in the school setting or in the home setting or in social interaction with other children or in the parties when you go to the children. It will be present in all different settings. But as a question, I've seen a lot of children who really do so well in school because they have this structure in school which make, even if they have the problem, even if they have inherent problem, because it could be ADHD, attention deficit disorder, or it could be ability defined disorder, but since the structure in the schools help them to function, but you lack that structure in the house. I mean, if the child is running around in the house and nobody is doing anything about it, of course the child will be more than encouraged to repeat the same behavior. And that's why I think the problem has to be addressed with the family, that they have to be brought in treatment in a family session and therapy to address whether they are not doing the parenting the correct way, whether they're not setting the limits and boundaries, and whether the child is not being managed with all these behavior modification techniques in the home. So that's the way to address this problem in the home. So, oh, okay. I didn't hear the last part.
When a child is aggressive and he's around other kids in school, can being aggressive be contagious?
No, I don't think it's contagious, but I guess if you are aggressive, of course it's going to cause a reaction from the other children, and of course this can be like a chain reaction, and of course this can cause problems, and I have seen that. Honestly, I have been on the board of many Islamic schools. And I've seen in those Islamic schools that sometimes what happens that these kind of behaviors, these aggressive behaviors, are tolerated and nothing is being done about it, and then it becomes a chain reaction because the other child feels it is acceptable to do that, and this way every child starts doing the same behavior, and in that way, yes, contagious, but not in a medical way. There's no germs or viruses or bacteria spreading that. But yes, if it is not controlled initially by proper behavior modification or proper kind of management in the school and also in the house, yes, it can spread. Similarly, in a home, if one child is doing that and they is not managed, the other child will try to do the same thing. They will feel is okay to do that. And then that's how it spreads. Yeah, but not in a medical or biological way. Just going to the very important disorder I want to talk about, I really want to have some feedback from you guys, and this is called attention deficit hyperactivity disorder. This problem, and I think the problem has most myths in our society about this disorder. And a lot of them, they have this belief it does not exist. And they can say, oh, we can just beat the child up or use the Molotov at home in Pakistan, we can straighten them out. But that's not true. And if you do go in the background of this disorder, it has been studied in early 1900. And it was diagnosed as a minimal brain dysfunction. That's the early name of ADHD before. And then they found out that they are very, very clear and specific defects in the brain, especially in the frontal lobe. The frontal lobe is the part of the brain, as you know, the Quran says about that all the man's intelligence lies in the frontal lobe. And the frontal lobe is the area in which the child's intelligence, focusing, attention, concentration, and interaction depends. And if there's a defect in the frontal lobe, especially in the biochemical disturbance, then the child will not be able to focus and concentrate, just like any other normal child. And sometimes, parents tend to say that, oh, he will grow out of it and he's fine, and But you have to know this is a very, very clear-cut accepted medical disorder which has all its biological causes. They have done PET scans in which they have found in those frontal areas of the brain, the lack of blood circulation, which shows that in those children, who have suffering from that, they have a genuine medical cause of this disorder. So we have to understand this disorder from the biochemical and pharmacological point of view. Just commonly this disorder presents same way between the age of 3 and 7, but now they're saying it can also start even in adolescence, and sometimes it may start in late age, and it's mostly undiagnosed and unchecked in early childhood. And the same thing as with the opposition defiant disorder. A lot of time what happens, it presents early, that you will find this report from the child in the school. The child is daydreaming. The child is always sitting by the window watching outside, or daydreaming, or thinking about what's going on in the house and not paying attention. And sometimes the child is forgetful. You will see that this complaint from the teacher that the child is not bringing homeworks. The child is not even bringing the homework home. Forgets the pencils and pen and the books and assignments. And sometimes parents don't really pay attention. But this is the first sign that something wrong is going on. But this disorder presents mainly in the 3 areas. The first area is the lack of attention span, in which the child is not able to focus and concentrate. The child is, as I said, daydreaming and forgetful. And sometimes, when they're not focusing, they become easily bored. They say that, oh, I'm bored. I'm sure you heard this thing a long time. Your child says, oh, I'm bored. And the child get up, run around, move around, watch TV, eat something, come back, and sometimes they take 2 to 3 hours to finish their homework. But that's the first sign that something is going on here. Why the child is taking so much time to do the homework and is running around and trying to find distracted easily by any of the external stimuli like TV or anything else that's going on in the house. So that's the first sign that you should think that something is going on with the child. The second symptom in this disorder is the impulsivity. You have noticed a child is very, very impulsive, very, very impatient, cannot wait for turn. Like, I want this now. And I'm sure you heard that a lot of times, that the child goes to the mall, I want this now. And sometimes if you don't give it to them, they will make a temper tantrum. They'll start rolling over the floor and doing all kind of things. And after all that, parents say, okay, go buy it. And then the problem goes on. It doesn't stop there. And the child goes on with this impulsive behavior, constantly impulsive and not able to follow the directions, not able to wait for the turn, and sometimes they are also sometimes become so disruptive. They interrupt the parents, they come in between parents are talking, interrupt them, and they don't want to listen. And you get, oh, come on, can you stop talking now? I'm talking to somebody right now. Oh, no, I want to talk now. So you can see that. This is impulsivity in which the child really cannot wait for their turn. And similarly, this progresses. When they become adolescents, they also cannot wait for anything. They all want things right now. If these adolescents become drivers, they can't even wait behind anybody driving. They constantly overtake people. You have seen those youngsters driving. A lot of those have ADHD, which is constantly driving, impulsive, can't stay behind any car. Because their brain is working with so much energy. The main cause of this problem is increased excessive amount of energy, which is kind of bouncing in their body. And that makes them not able to stay still, not able to focus, not able to concentrate, and that's the hyperactivity part. The child is running around like a motor, like constantly running, and sometimes you can't take them to any family members or any party, because they run around so much, they get into fights, physically aggressive, that you feel ashamed to bring them. And sometimes you say, okay, let's not take them to the party. But that's not the solution. But these are the main 3 areas, poor attention span, impulsivity, and hyperactivity. Well, sometimes you may only see poor attention span only. Some children only have inattentive time. Like they are fine with the activity, they are fine with that, but they are very unfocused, But the bad part in that is the child also is very smart. Most of these children, you will be surprised, they're very, very smart children. They have enormous amount of brain activity going on. And they can do things like this. Like if you give them a solution, if they're really focusing, they can solve the problem in a second. They're just so smart. But because of this energy bouncing in their body in such a way that they're not able to organize their thoughts and able to do things. That's why you will see sometimes they get A+, sometimes they just D's, all D's. Like you see this very inconsistent behavior of performance in school. And it should make you raise your red flag, what's going on here? Why my child is smart, he gets A+, how come he's getting D's now? And that explains their behavior, what's going on in school. So these are the three main areas in which the child presents. And last times, if these can be diagnosed early, like you can, when you see that, most of the time what happens, these children are seen, but most parents, they don't believe in psychiatry, so they take them to the pediatrician or to the neurologist. They think it's a neurological problem. So maybe a neurologist can solve the problem. Well, a lot of neurologists do treat ADHD, I understand that, and a lot of pediatricians also treat that, but they will not be able to address the psychosocial aspect of it. They won't be. They won't be able to understand that. So there was, something somebody mentioned, we give them pills. You'll be surprised. More pediatricians and more neurologists prescribe stimulants for these children than the psychiatrists. You'll be surprised, the numbers, that more and more neurologists, because what happens, because the neurologist, if you take the child to the neurologist, of course, their training is focusing on the medical aspect. So of course they'll give you medicine right away. If you go to a pediatrician and they're diagnosed with the ADHD, that's 1, 2, 3. They give you like a simple test, ask you questions, oh, it is ADHD, you start the patient on Ritalin. I start the patient on Adderall right away. And this is more commonly seen with neurologists and I'm nothing against neurologists in that regard. I'm just telling you that's why most of these children get on medicine right away as soon as they're seen by a neurologist or pediatrician. But they never get to see the psychiatrist. You know when they see the psychiatrist? When the child is not being, despite the medication, because they're not addressing the other aspect of it, the child gets worse and worse, getting into trouble, aggressive, and all this legal problem happen, they can call psychiatrist. Refer the patient to psychiatrist.
I think the battery kind of died out.
Yeah, can you fix that?
That's okay, we got enough. We always have an electrical power back.
Oh, okay. So this is the, this is the, so these are something we always have to be, when we see a patient, a child, I see that all the time, and most of the time, honestly, they come to me not in the early stages. They already have been diagnosed, given medications by pediatrician and neurologist, and then when things got worse, they come to me. That my child has been in trouble, is suspended from the school, they want to remove him from the school, or that the child is getting into legal problems, stealing, or hurt somebody badly, or destroy some property, and then they come right away, oh doctor, I will need to see you right away tonight, I need a letter from you. I hear this all the time. They want to see you right away, because they are now the school is on their back, or somebody else on their back, you have to see a psychiatrist now. So this is why you want to really go through all that. Why not you just use your common sense, and if you see these problems, since, alhamdulillah, we are, as Muslims, we are supposed to address these things. That we are supposed to accept the realities and not to deny those realities, because as a Muslim, you have to do that, as a Muslim, and address them as soon as possible, because this is the health of your child. This is your future, and I think it's very important to address that in that way. So similarly, talking briefly about the diagnosis and treatment, as I mentioned, these are some of, we have some very new tests available now. There are some scales available, ADHD rating scale, we have Conners scale, which sometimes what we do when we see a child, the first thing we do, that we have them fill, the parent and the child, a questionnaire, which is called childhood behavior checklist. And also there is a Conners questionnaire for the parents and for, of course, for the teachers. So you give them that so that you can see really what's going on in the house and the school. And after reviewing the parents' questionnaire, the teacher's questionnaire, and of course you're doing the behavior checklist, then on the basis of that you diagnose the child. And also, of course, you have to do a workup. I always do a medical workup in which we rule out any other possible medical causes like lead poisoning or any genetic disorders like fetal X syndrome, and all the things we rule out before we go to diagnose them with attention deficit disorder. And once we reach that point, then we offer the parents a treatment. Of course, the treatment is also multifactorial, just like the cause of this condition is so many. The genetic factor is very common. Parents who themselves have ADHD, a lot of times parents come, I cannot do this. Sometimes you diagnose parents when you see children. Doctor, I cannot also focus and concentrate. I take long time to do the work. I'm sometimes lost driving, So these things, you know, they mention to you, and you say, well, gee, this thing can be genetic, and this is true. It's highly genetic. It's highly genetic condition, ADHD, and you know these factors you have to keep in view. So that is something, and the psychosocial factors like stress in life,